Our final section of neurology, you have survived. Root. Look for that nipple. Look for that nipple. Look for that nipple. Root, snout. Root, snout. Palmomental. What that means is that you are meant to find nipples. You are meant to kiss people. You are meant to grab onto mama's fur and branches before you fall off. These are tested by tickling the side of the mouth, snouty, 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 hitting the palm. And they are early, primitive reflexes that are normal in babies. And the most accurate test is to look at a scan of the brain to see why have they recurred when you're older.
We can look for evidence for other pathological reflexes. We're going to now test for frontal release signs. I want you just loosely close your lips. Good. And I'm just going to push. No, don't push against. Just relax. Totally relax. Good. Looking for a snout reflex. You didn't have any movement there. Any sucker or root. I'm going to stroke the palm. And what we're looking for here is called the palmomental reflex, which would be stroking the palm and looking to see if there's any type of contraction of the mentalis muscle. So we're going to stroke, and there's none, which would be the normal. And now on the other side, looking at the mentalis muscle right here. No evidence for contraction there.
So rooting is tested by stimulating one side of your mouth and seeing if it moves over to that side. And the head and the mouth automatically turn in that direction. As a baby, we're trying to find that nipple. Find that nipple, man. That's our earliest thing. And snout is tickling the upper lip. Puckering the lips. I'm not sure what that's good for, but it means we're meant to kiss people. Palmomental, so you don't fall out of tree branches. You stimulate the thenar evidence, and you should grasp, grasp, grasp. Okay, you should grasp it. And contraction of the muscles of the chin. Okay, palmomental is also here. Palmar reflex and stimulating the thenar eminence. And the hand and looking to see if you also have contraction of the mental muscles of the chin. Isn't that interesting? Oh, they're normal in babies. The problem is in adults when they come back, it means you got major brain damage like Alzheimer's disease. Major brain damage like Alzheimer's disease. In this case, they're called frontal release findings. So severe generalized disease is assessed by the CT or the MRI scan of the brain because you're looking to see if there's diffuse symmetrical atrophy, primitive rooting reflexes. Easy, but bad in an adult. That's what Alzheimer's is like. You see, babies are difficult to manage, but they're not 6 feet tall and weigh 140 pounds. Okay, so spastic diplegic gait. Whew. This needs video, I'm sure it does. When is this gait? Must be brain damage. Yee, diplegic gait. I think that rather than talk about it, time to show you.
The next gait is the spastic diplegic gait. In this particular gait, both lower extremities are affected, and the lower extremities are affected more than the upper extremities. So the posture, the position in this particular gait is there's flexion at the hips, flexion at the knees, and the feet or the ankles are extended and internally rotated, and there's also tight adductors, so there's adduction at the knees. So it is a swinging gait with both sides, both lower extremities. You can hear a different pattern than the hemiparetic gait. But this is not all. The upper extremities are also involved. Again, not as much as the hemiparetic gait, but for the upper extremities, the extremity is carried in a low guard or a mid guard position, and you don't have the normal associated movements in the upper extremity. So this would be the type of posture and type of position that one would see for the spastic diplegic.
So what this is that this is a bilateral circumduction of the legs, and it's just a difficult gait that basically happens where both things are moving in a semicircle because there's spastic, meaning tight muscles, parapresis. In other words, it's weak and tight. Bilateral weakness and tightness of the legs. And that bilateral weakness and tightness of the legs makes it like a bilateral version of the hemiplegic gait. A bilateral version with weakness, that's all. It's really just saying bilateral weak legs. And it's caused, by spinal cord diseases or cerebral palsy, bilateral weak legs. That's all it means. It's a fancy word for bilateral weak legs. Okay, a straight leg raise test. Now, a straight leg raise test is a sign of radiculopathy. Are you having nerve roots compressed or not? The straight leg raise is a measurement to see as the leg lifts up, are you having compression of the nerve roots? Now, the abnormal or positive test is that as you bring it up to 40 and 45 and 60 degrees, you feel pain going down your back and shooting into your legs. The most common cause of this is nerve root compression. Now, is this spinal cord compression?
I'm going to keep the leg in a fully extended position and then perform hip flexion passively while maintaining extension in the knee joint to about 70 degrees. The symptoms of the patient should arise between 35 to 70 degrees of hip flexion. Above 70 degrees, the stress is mainly put on the SI joint or the lumbar spine.
So, is this spinal cord compression? And the answer is no. Straight leg raise is performed by having a patient lying on their back and you grasp their ankle, lift it towards the ceiling and flexing the leg upwards, flexing the leg upwards, and it is a sign of L5, S1 radiculopathy. So, straight leg raise testing is not a sign of spinal cord compression. It's a sign of discs compressing nerve roots. When you see it, does it need steroids? No. When you see it, does it need an MRI? Most of the time, no. Does it need a spine x-ray? No. It's nerve roots being squished a bit. Now, dorsiflexion of the foot, in other words, pushing the foot up, pulling the foot up, plantar pushes it down, dorsi pulls it up, is gonna make this worse. And there's increased pain in the affected leg when the opposite leg is raised as well, and this means radicular pain. This is really hard for people, straight leg raise, because people it's very easy to confuse with actual spinal cord compression. It's not actually spinal cord compression. It's not. So spinal cord compression is something that needs steroids. Spinal cord compression needs an emergency MRI. Spinal cord compression might need surgical decompression or steroid injection. Steroids IV, but not radiculopathy. You see, the most common cause of a straight leg test is nerve root compression by a herniated disc, but that's not compressing the cord. It's compressing the roots. Tandem gait. Well, heel-to-toe walking is a type of cerebellar problem. Heel-to-toe walking, heel-to-toe, to-toe, to-toe, to-toe. And it's done when you see this abnormality, it's kind of looking for cerebellar disorders.
Now I'd like you to walk like walking on a tightrope with one foot right in front of the other, heel right up against the toes, and walk down and back that way.
So this tandem walking is by putting one toe and one foot in front of the other toe. The toe is tail is placed in front of the toe of the other foot. A normal person should be able to walk heel to toe without wobbling, says the guy who's pulled over for DUI. You should be able to walk over. These abnormalities imply ataxia. This is like a finger to nose. It's like a heel to shin. It's a cerebellar disorder. It's a heel to shin. It's a finger to nose. And this can be from a stroke of the cerebellum or damage of the posterior columns of the spinal cord. B12 deficiency, damaging the cord, damaging the cerebellum. Brain damage, damaging the cord, damaging the cerebellum, and it's ataxia. So the other thing is, this is why if they bring you over for DUI and see if you're driving while you're drunk, they ask you to walk in a straight line, which is not too accurate. Now, is it? What's this?
Thanks. And say baseball player, baseball player. Okay. Caterpillar, cantaloupe. Okay. All right. I'd like for you to do some things now with your mouth. First thing I'd like for you to do is stick out your tongue. Stick your tongue. Great. Show me how you would kiss. Show me how you love to kiss me. There you go. Good. Show me how you sip on a straw. Can you sip on a straw? See what a sip sticks. See what a sip sticks onto me. Okay. Try this one. See. Wait a minute. Listen. Show me how you smile. Show you how plus me. Show how plus me. Show how plus me. Show how plus me. Stop. Can you smile? Can you smile at me? No, don't smile at me. Don't say what I say. I want you to do this. Watch. What? Look at me. Smile. There you go. That was a very good one, huh? Smile. Smile. There you go. Chew. Show me how you chew gum. Chew what you so my children's thing. Okay. Watch this. Good. All right. Cough. Cough while you cough me. Cough. There you go. I want you to lick your lips. Let me lick them. Great.
Ooh, this could be from thiamine deficiency. The most accurate test is to scan that brain.
Amelia, what is this? Westland. Orbit. And this? A tuker. How about this? Ball. This? A nugget.
So Wernicke's aphasia can be caused by thiamine deficiency. But have you seen? It's fascinating, isn't it? You can't say the things. People don't even know they have this. People just get frustrated. They can hear the words and understand the words, but they can't do anything about it. It's a fluent speech. They can't understand what's being said. Okay, and what's worse about it, you see this devoid of, without effort means they don't really know that what they're talking is garbage. Normal word count, making up words. It's a perflaggity, persnickety, ickety dickety. I mean, the time, 'twas brillig in the slivey toves, the diet and gimble in the wave, the jabberwock went all snicker snack with his mighty vorpal blade. That's Wernicke's, man. And also, it may have been that he was describing people who are alcoholics at the time, Lewis Carroll, because people don't even know that they're making up words and empty phrases. And they're unaware of it, so they're not getting frustrated, okay? Only until they find out, why aren't you understanding me? It's like you're walking up to somebody and talking in a different language. Like, well, how come you don't understand me? I can hear you. I can't understand you. I can hear you, but I can't understand you. And it can be from a stroke of the temporal lobe or intoxications or thiamine deficiency. Scanning the brain is the most accurate test to see if there's damage of the temporal lobe.
1 plus 5. Wait a minute, no. It's a pretty hard class to get into this one day. It's fine over there loft, see. It's clause. It goes for about over 30, see, or 130 for down, see, in front of out for it goes straight against her, and then it comes back to the against her for 4, and then goes out for the rest of the time. The third is not the servant, but the soldiers, where they have the soldiers of the same verbs and the subverbs and all the first subverbal and watch out in the short side, and they cross with the sugar 2 hours 2 high or low. Wowie! God, these are terrible. Wow, these are terrible words.
Wow! Wow! Isn't that amazing? See you in the next section.